Singapore is looking into extending COVID-19 vaccinations for children aged 5 to 11. At the same time, unvaccinated people who get infected will also need to foot their own medical bills. Sherlyn Xia with the details.
Singapore's expert committee is now assessing vaccinations for kids aged 5 to 11, following recent approval by United States authorities for the Pfizer shot in kids of that age group. Studies there have also shown effectiveness, using 1/3 of the dosage given to adults. The committee here will make its recommendations on whether the vaccine is suitable for this age group by the end of November. Singapore's Health Ministry will soon begin a study involving several hundred children using the same reduced dosage and to study its effectiveness in a local context. This comes as Singapore reports its 5th child out of over 8,000 paediatric cases to have gotten what's called a multi-system inflammatory syndrome, or MISC. And that's where certain vital organs like the heart or lungs can get inflamed due to COVID-19 and patients may need intensive care. Singapore is now looking at whether it can use the existing stock of Pfizer vaccines here to adjust the dosage for younger kids.
We are pushing ahead with vaccination for children aged 5 to 11 years as soon as we can. And this is so that parents have the added assurance and peace of mind that their children can become protected. And once vaccinations cover children aged 5 to 11 years, we would have left only a small proportion of our population not covered by vaccines.
It was also announced that infected cases in Singapore who choose not to get vaccinated will now need to foot their own medical bills. MOH says that unvaccinated people currently make up a sizable majority of those needing intensive care and are contributing to the strain on healthcare resources. Hospital occupancy rates remain high, although the task force says numbers are stabilising. Bed capacity will also be ramped up from 2,500 to 4,000 by the end of November, including the private sector and COVID-19 treatment facilities. The task force also addressed recent clusters involving nursing homes and the Institute of Mental Health. While measures there are being stepped up to ensure safety, they remain a challenge due to the profile of the residents.
Not all of them find it comfortable or it's very difficult for them to wear a mask all the time. And therefore, the potential risk of spread occurs in such communal settings when these residents interact very closely with each other. We have been aggressive about reaching out, trying to promote, educate, and to get all residents and staff to continue to comply with hand hygiene, infection control measures, the safe management measures, and we will continue to do so in order to promote a safe environment.
But the task force adds that many of the new cases being reported have already been isolated, showing that the nursing homes have been taking steps to reduce the spread. It also reinforced that the majority of transmission among the elderly are still taking place within the community.